Abortion care clinics are readjusting their services after Tennessee's heartbeat bill went into effect this week. One abortion clinic in Mount Juliet says they're not closing their doors, but they are having to turn clients around. WSMV's Danielle Jackson spoke with that clinic tonight. Danielle.
Tracy, clinics are having to turn away patients because of the new abortion ban. I talked with the Chief Operations Officer of CareFem, a reproductive and sexual health clinic in Mount Juliet. She says it's been very difficult turning away clients and redirecting their care to different states.
Do you feel like you can come into the health center that day? How far are you traveling? Is it worth it for you to keep an appointment? And many said yes. We still had people we had to send away.
Those are just a handful of questions Melissa Grant, the Chief Operations Officer of CareFem, says her staff asked patients this week after abortion 6 weeks or later became illegal in the state. Grant says just yesterday they had to turn away half of their clients after the abortion ban went into effect.
Now that we'll be unable to provide care in many circumstances, if not most, we'll be seeing clients traveling those long distance again out of state in order to receive what's otherwise legal health care. And it's shocking, dismaying, and really hard for the patients that want the care as well as for my staff.
This clinic offers services like birth control, sexual health education, pregnancy tests, and abortion care services by the pill or procedure. They're not planning to shut down. Instead, they're modifying their services according to the law.
Instead, what we did was to look very carefully at the obligations of the law so that we were ready on a very short-term moment's notice to change, to become compliant.
She describes one of the many difficult scenarios her staff navigated patients through this week.
We even had one of our clients yesterday who expressed that maybe she was going to have to look at self-harm. And that was the hardest thing for our clients. We've had people say that to us before. And ultimately, we can usually find ways to either assist, whether it was money or a different provider or something.
Moving forward, they're working to help women with receiving care out of state if they don't fall within the limits of the law.
And it's so hard to tell somebody that once they've had the courage to contact us, to come into the clinic, to look at payment, to voice this need that's so stigmatized, to say, I'm sorry, I can't help you. It's devastating.
CareFem says they will continue providing abortion aftercare services for women who are 6 weeks or less, as well as pregnancy testing. Abortion care needs can also be found within the National Abortion Federation. Marius.